Hi, everyone. Thank you for hopping in and joining this week's webinar. And today we're doing our webinar with Franchise Benefit Solutions. This is going to be our open enrollment webinar for 2024. Franchise Benefit Solutions has been a preferred vendor with us for 2 to 3 years now. They're one of our first, and they've been able to help dozens of you obtain, employee benefits for your technicians and your office workers. It's just a great way. What we've noticed a lot of retainment and employment and helping with recruiting. There's just a lot of benefits with this, and then not to mention the healthcare alone with employees. So on the call, before we jump over to FBS, I just want to introduce Mandy back up, and she's our new vendor manager over here at 5-Star. Do you want to say hi to everybody?
Hey everyone, I'm super excited to be on board and just get to know everyone. So I'll probably be reaching out just to get to know everyone and really excited to be on board.
So she's going to just be helping you get on board with vendors or answer questions about vendor programs, things like that. Really just becoming like a liaison between the vendor and our franchise owners, just to make sure that your life is easier and we can save you some time and save you some money. And then on the call from Franchise Benefit Solutions, we have Bernard Rubenstein and Michael Rubenstein, and they are the managing director and operations manager over at FBS. And so Bernard, I don't know if you want to just kick it off from here and jump into your presentation, but that'd be great.
I'll let Michael lead off here first. Go ahead, Mikey.
Sure.
I'd like to welcome everyone to today's presentation. If you do have questions throughout this presentation, feel free to ask them at the bottom of your screen, and we'll get to them at the conclusion of it.
Thank you, Stuart and Michael and Mandy. Good morning, everyone. Over the next 30 minutes, we're going to cover facts about franchise benefit solutions, challenges facing franchisees today, why offer benefits to your employees, our program advantages, our 2024 product portfolio, solutions to help you hire and retain employees, key provisions of the Affordable Care Act, 2024 open enrollment, and like Michael mentioned at the end, questions or comments. With over 40 years of experience specializing in customized benefit programs to the franchise community, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Best Life Brands, 5-Star Franchising, Valpak, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, franchisees have expressed an interest in offering alternative benefit plans to help recruit and retain employees. Some of the challenges that we find facing franchisees today: hiring and retaining employees is probably the biggest challenge. Offering affordable health plan options. New franchisees that come into 5-Star Franchising have limited benefits knowledge because they generally come from the corporate world. And ACA compliance issues for franchisees that may have over 50 full-time employees. Why should you offer benefits to your employees? Employees are the heart of any great business, and key employees and leaders are essential to long-term success. Once you get a great team in place and they're performing well, it's a huge blow to lose any of your indispensable employees. Benefits are no longer a perk in today's business world. They're an expected part of compensation. Here are a few good reasons to offer benefits to your employees. First, attract and retain your best employees. By offering quality benefits, you will attract and retain qualified candidates for your business and keep your best employees happy. Increase your bottom line. By offering benefits instead of higher wages, you win by having a lower wage base match for state and federal unemployment taxes. Boost morale. By offering a benefits package, you show an invested interest in your employees. In short, benefits can help promote good morale by keeping employees happier and healthier with less turnover for your business. Promote employee health and wellness. When employees have access to wellness, preventative care, doctor visits, and telemedicine programs, your overall business environment is healthier. Fewer employees are out on sick days and fewer people coming in to work while ill equals increased productivity and profitability. Beat the competition in the race for talent. By offering an ACA compliant health plan and voluntary benefits, you can beat out half your competitors that do not offer benefits. And finally, create loyalty. Health insurance is an emotional offering that says to your employees, you're a valued asset to this company and we care about your health and well-being. You're probably thinking, why Franchise Benefit Solutions? What's the advantage of your program over other programs? Or what if I looked at a similar plan on my own? First, we offer exclusive group plans and rates, all with guaranteed acceptance and no waiting periods. Our plans and rates are the same no matter where your franchise is located. If you have a franchise in Florida, Michigan, Washington, or California, the plans and rates are the same. We don't require employer participation or contribution. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. You choose the benefit you want to offer your employees, and your employees enroll online through our online portal. Our products portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Like I said, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. Our benefits program includes 3 medical options: individual and family, comprehensive group, and voluntary group. We get calls all the time wanting to know the difference between comprehensive or voluntary medical. The choice between comprehensive and voluntary plans is not one size fits all. Some may prefer the extensive coverage of comprehensive plans, while others prefer voluntary plans that address specific healthcare needs. On your screen, you can see the difference between comprehensive and voluntary. Comprehensive plans offer a wider range of medical services, including wellness exam, doctor visits, lab and x-ray, urgent care, emergency room, hospital stays, prescription drugs, preventative care, and other specialty services, such as outpatient surgery, home health care, again, other specialty services. Whereas the voluntary plans offer limited scope of coverage that are typically focused on specific types of care, such as wellness exam, doctor visits, urgent care, lab and x-ray, additional plans such as accident, critical illness, and prescription drugs. The cost, comprehensive is going to have a higher monthly cost, but lower out-of-pocket cost when you need Medicare, such as your deductible. For the voluntary medical plan, the plans usually have lower monthly cost, but they require the insured individual to pay a higher share of costs or out-of-pocket costs. Mandatory or optional, the comprehensive plans may be required by your employer, or even the benefits may be mandated by law, whereas the voluntary, they're typically mandatory as an option add-ons to the employer-sponsored benefits package. So the voluntary plan is not mandatory, where the comprehensive may be mandatory because of the insurance carrier or mandated by law. So there are differences between the two. So we do offer both comprehensive and voluntary. Comprehensive generally are HMO point of service and PPO plans, whereas the Voluntary is generally just going to be a PPO through a specific network. For those franchisees that don't want to offer a group plan for their employees, but are looking for an individual medical plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. Once you input your information, you can compare affordable medical plans from different carriers, find out if you qualify for financial help, view benefits at a glance, view local providers, and apply online or download an enrollment form. If you're considering your group options, we can help you make the right decision that best meets the medical care needs of you, your business, and your employees. Group plans are based on the demographics of your business, along with your employee and dependents' ages. We would need census information in order to provide you with a group plan proposal. Our third and most popular option is our low-cost volunteer group medical plans, similar to an association health plan. The plans are the perfect strategy for franchisees focused on cost containment, usable daily benefits, and compliance with ACA mandates. The WellCare plan covers preventative services only. The Prime Care plan is similar to the WellCare plan. However, this plan includes primary care office visits and prescription drug plan. The Elite plan covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. The IHP plans provides more comprehensive coverage, such as in and outpatient hospitalization, emergency room, pregnancy, home health care, chemical dependency, and prescription drugs. So as you can see, again, the WellCare plan only covers preventative services. That may be the exam, any type of preventative services, any type of blood testing, mammography, or colonoscopies is covered under the WellCare plan. Primary care is similar to a WellCare plan. However, it also includes primary care office visit and generic prescription drugs. The Elite Care plan includes primary care visits, specialists, urgent care, lab and x-ray, and prescription drugs, and they include simple copays. The IHP Basic and Premier is more of a comprehensive plan, whereas the Elite, Prime Care, and WellCare do not cover inpatient, outpatient, and emergency services, whereas the IHP Basic and Premier do include those services. There is a requirement of 5 employees required for the IHP plans. Those plans also, benefits are subject to reference-based pricing, which means if you see the asterisk next to the services, what that means is the reference-based pricing is if that hospital or facility is a Medicare recipient, then the insurance plan will be good for those type of services. So again, if you see those asterisks next to the services, that means that hospital or location, if they accept Medicare, then they will accept your medical plan. Our voluntary dental program includes 3 plans through MetLife. If you're looking for a DHMO plan and you're located in California, then you're able to enroll in our HMO dental plan. Our PPO plan through MetLife. The 3 plans include Plan 3 and Plan 4, benefit maximums up to $1,000. Plan 3 does not cover orthodontia, where Plan 4 does. Plan 5 is the same as Plan 4, except the benefit maximum is $2,000. The covered services, preventative services on all three plans are covered at 100%. Basic services at 80%. Major services covered at 50%. Orthodontia for Plan 4 covered at 50% up to 1,000 lifetime, while Plan 5 is covered at 50% up to 2,000. HMO dental plan in California, simple copays. It is not based on covered either 100%, 80 or 50%. It's simple copays. Office copay is a $5 copay. Preventative services covered at 100%. As you can see, the other services are covered at simple copays. There is no maximum on this, so whatever the copay is, all you would pay. Our voluntary group vision, we offer 2 plans through VSP, which is administered also through MetLife. We offer 2 plans. Both plans have a $10 copay once every 12 months. The lens frames and or glasses and contacts. Plan 1224 has a $25 copay once every 2 years or 24 months, while Plan 1212 has a $25 copay once a year or once every 12 months. So again, the 2 plan differences, 1224 is a $10 eye exam and $25 copay every 24 months for glasses or contacts, while 1212 is a $10 copay once every 12 months, and glasses or contacts, $25 copay once every 12 months. Additional retail chain providers that you may visit, Costco, Vision Works, and Sam's Club. Life insurance, we offer 2 plans through MetLife. The first is an employer pay of $10,000 benefit option, which includes AD&D. Second option is voluntary life. Now, this is employee pay, not employer pay. You can your employees can select up to $150,000 or 5 times their annual pay. They can also purchase up to $50,000 or 50% of what the employee selects. Again, that's up to $50,000, and dependent children, they can select up to $10,000. Evidence of insurability is not required when they're first eligible. So let's say one of your employees did not select life or voluntary life in the first year. Second year, they decide they want to look at voluntary life on themselves. They will have to answer health questions. So again, 2 life options: employer pay up to $10,000 plan, voluntary life employee pay. They can select up to $150,000 for themselves, spouse $50,000, independent children up to $10,000. Beginning 2024, we are implementing a new virtual primary care and telemedicine plan. Our primary care plan is similar to having your own medical plan, going into and visiting your own primary care physician, except the new plan is a virtual primary care. It includes a primary care services. You select your own dedicated physician, just like you select your own primary care to go visit. Same thing on the virtual care. Select your own dedicated physician. Your primary care services include annual wellness exam, health risk assessment review, screening lab review, follow-up visits, care plan development, ongoing support, chronic condition management, post-lab ordering and review, and specialist coordination. So basically, the virtual would include you speaking to your own primary care. You would have your own wellness exam. They would send you a blood kit. You would send the blood kit in the self envelope. That your primary care would then reach out to you, go over your blood test, and then have any recommendations. They'll also include electronic prescription ordering. It also includes integrated urgent care, which is the same as a telemedicine plan. So if you need to speak to a telemedicine doctor, you could call in and give them your symptoms. They'll give you a diagnosis and also call in a prescription. It also includes psychiatric and behavior health, on-demand counseling, which would virtual consultations, including topics such as anxiety, grief, depression, marital issues, and stress. Includes 8 face-to-face referrals, set number of in-person visits with a licensed behavior health clinician, and also include a prescription drug benefit, where there's a zero copay, and it does include a broad prescription list. So again, this is new for 2024. We added this because of the psychiatric and the behavior health. We've had many questions on it, so we decided we would include this for this year. And it is becoming a big program. You'll find that comprehensive carriers such as United Healthcare or the Blues, they're beginning to add this type of program to their benefit plans. Also is our telemedicine virtual urgent care. That's a 24/7 access. There's no cost to it. There's one price for family coverage. It includes all members of your family. If you have, like I said, on the virtual primary care, if you're at work and you needed to speak to a doctor, you call in, give them your symptoms, they'll give you a diagnosis, and they'll even call in a prescription. Volunteer hospital plan. We offer 2 plans. Choice of 2 benefit options. Benefits cover both injuries and sickness. Benefits are paid for inpatient and outpatient medical treatment received in a hospital emergency room or the doctor's office. Additional benefits include surgery, anesthesia, diagnostic exams, pregnancy, and lodging. We find that most employers will package the voluntary hospital with one of our voluntary medical plans. That way there's additional coverage for the employee. Voluntary accident plan covers accidental injuries regardless of any other insurance. Benefits cover both inpatient and outpatient treatment. Covers more than 50 benefits, including hospital admission, hospital confinement, ambulance, emergency room treatment, in addition to the services that are covered. It also includes a lump sum payment for fractures and dislocations. So for instance, let's say you fracture your hip, they'll provide you, or they'll pay a $5,000 lump sum payment. Or let's say you dislocate your knee, it'll pay an addition or a lump sum of $2,500. Some of our most popular solutions to help you hire and retain employees. We find that there are 4 packages that most employers will select one of the packages. And what I'm showing you here is we can actually help you set up the program. This is more of an example of what we find that employers will select one of them. Package 1, employer offers a dual voluntary medical plan and contributes towards the employee only cost. The employee contributes the balance of the employee cost plus dependent cost and any buyout plan. Employers then offers the voluntary benefits at 100% employee pay. I will say that probably 99% of employers may contribute towards the voluntary medical plan, but all the voluntary benefits, the dental, vision, life, telemedicine, accident, hospital confinement, generally the employee pays 100% of that. Package 2, the employer enrolls in a management-only group health plan through the special enrollment period, which I'll get into in a minute. The employer contributes 100% for themselves as the owner. Management, 50%. And then the employer offers voluntary benefits to non-management employees, 100% employee pay, as I mentioned in package 1. Package 3, employer enrolls in a comprehensive group health plan, offers dual medical option, and contributes 50% of the employee cost of the lowest plan. So you may offer more than one medical plan and contribute towards the 50% of the lowest plan. The employee then contributes the balance of the employee cost plus dependent cost and any buyout plan. And then the employer offers voluntary benefits at 100% employee pay. In package 4, which is becoming really our main package that employers are selecting, employer offers voluntary benefits to all employees at 100% employee, which would include the voluntary medical and then all the additional voluntary benefits. So again, package 4, employer, let's say they can't afford to put in a plan to contribute, then they would offer all the voluntary benefits at employee pay 100%. Cost breakdown, here's an example. The employer would set up classes of employees based on the job title. Class 1 could be ownership, class 2 management employee, and class 3 non-management employee. Step 2, the employer sets up a comprehensive group medical plan for ownership and management level employees. The employer contributes 100% for ownership of themselves and 50% for management employee. Step 3, employer sets up voluntary medical plan for non-management employees at 100% employee pay. And step 4, the employer offers additional voluntary benefits to all employees at 100% employee pay. So looking at monthly costs, and again, this is an example, the owner, age 55, enrolls in with United Healthcare, a PPO program, a $2,000 deductible, 80/20 coinsurance, $40 primary care physician copay, $50 urgent care copay, and a $15 prescription drug card. Monthly cost, $885. Obviously, they're going to pay 100% for themselves. Management employee, let's say they're age 47, also enroll in a United Healthcare plan. However, the PPO plan would be set up with a $5,000 deductible instead of $2,000, 80/20 coinsurance, same office copay, same urgent care copay, and prescription drug card. However, the cost is, let's say, $657. The employer would contribute $328, same with the employee contribution. So basically, they're contributing 50% each. Non-management employee, let's say age 35, they would enroll in the voluntary medical under the Elite Care Plan, which has a $15 primary care copay, $50 urgent care copay, 4-tier prescription drug card. Let's say the cost is $118. The employer does not contribute at all, and the employee contributes 100%. So again, we're showing you here different examples of setting up a program. We will help you set it up. You decide how you want to set it up, but we'll help you set it up. And here's just an example way that you can set it up. Let's switch gears here and talk about the key provisions of the Affordable Care Act. The individual mandate no longer exists. In most states, individuals will not be penalized for not having health care coverage. The employer mandate, however, remains in place, at least for now. Congressional efforts to repeal and replace the ACA have stalled. I heard just yesterday that Congress may take up the employer mandate next year and not allow certain medical plans to be offered. Also, in California, Governor Newsom has set up a task force to examine universal care throughout the state. Let's take a look at a few provisions of the ACA as of today and how it will affect you. A full-time employee is an employee that works at least 30 hours. Benefit waiting periods must be 90 days or less. Employer with less than full-time equivalent employees, less than 50 full-time equivalent employees are not penalized for not providing health insurance. Employers with 50 or more full-time employees must provide health insurance or be required to pay a penalty. So again, a full-time employee is an employee that works 30 hours. We find some employers will call us and say, well, we require 40 hours. Under the ACA, an employee, an active full-time employee that works 30 hours would be required under the ACA. Benefit periods must be 90 days or less. So what a way of setting that up would be first of the month after, first of the month following 60 days after their hire date, which could be 90 days. If you have less than 50 employees, you do not have to offer health coverage or medical coverage. If you have more than 50 employees, then you must provide health insurance or pay a penalty. Looking ahead to 2024, there's a little known requirement under the ACA, which requires health insurers to offer an annual 1-month special enrollment period from November 15th through December 15th to employers in the small group market who do not meet the employee minimum participation or employer minimum contribution requirements. Many insurance brokers do not know about this requirement, and insurance carriers do not want you to know about this, mainly because we need 2 employees to enroll and there's not enough risk to cover. So basically they want you to pay, or they want you to contribute 50% of the employee cost, and they require 50% of the your employees to participate. Under the special enrollment period, 2 full-time employees must enroll. Just so you know, under the ACA, husband and wife are considered as 1 employee. Our benefits enrollment platform includes 4 steps from the initial contact through the employee enrollment process. Identifying the employer's objectives, reviewing your benefit options, providing easy to understand benefits communication, and optimizing the enrollment process through our integrated portal. So really from the beginning, step 1, that we initially speak to you, through the step 4, which is the enrollment process, we're here to help you. So at the beginning, we'll identify your objectives, determine what your budget is, and then we may have to gather some information, census information, to provide you with, let's say if you're looking for a comprehensive program. Once we obtain quotes or we send you our employer guide, then we'll review the benefit options and come to some type of formulated benefits plan. Step 3 will provide you with a easy to understand communication that you could distribute to your employees. And then step 4, we build out a employee enrollment portal, which how the online enrollment works. At the time of orientation or the time that we set up the program, we will send you, or you will send the employee logins to your employees. The employee will create the password and complete the registration. They will verify their personal information, add any additional dependent information. They will then begin the step-by-step enrollment process. For each benefit, they will need to choose their coverage level by either enrolling in the plan or waiving. So they'll have 2 options, enroll or waive. They will continue until the enrollment is complete. At the end, they'll review their benefit summary and then e-sign their enrollment form. If at the end they're not, they don't receive a portion of it that says to sign your enrollment form, that means they did not complete their enrollment. They will be required to go back to where they missed either enroll or waive. Again, enrollment is not processed until they e-sign. Our plans are integrated with the carrier. So if your employees do not complete their enrollment, then we will not know, or the carrier will not know that they've completed their enrollment, even though they may think that they did. So now that we're at the questions area, Michael or Stuart, if there are any questions, if you want to ask the questions, and I will answer them.
Yeah, I don't see any questions at the bottom, but everybody viewing this, please type your questions at the Q&A box at the bottom, and Bernard can handle those for us and can answer those. And appreciate the going through that, Bernard. And I do remember last year a ton of owners from Mosquito Shield were asking about seasonal employees. I know I'm not sure if you touched on it today, but I was going to ask you, would you be able to touch on seasonal employees and how someone could possibly keep someone like that insured throughout the year?
Now, again, that's going to be up to the employer, how they want to approach it. Michael, do you want to explain a little bit about the seasonal for the enrollment on if they decide to jump on and jump off, how long they would be covered for?
No, I mean, you really just touched on it. If an employer wants to offer it to their seasonal workers, they're able to structure it however they might choose, and you know, take them on and off coverage as they see fit with it.
So basically, it's up to the employer how they want to set it up. They have control. The one thing I will add to, if they do have part-time employees, they may not want to cover the part-time employee, because if the employee leaves and the employee is contributing to the program 100%, the employer will be responsible for the payment. So the employer may want to only cover the full-time employees and not the part-time. But again, it's up to the employer how they want to set it up. Some of the employees may have paychecks that still owed to them after they leave, so they have ample enough to deduct it. But we don't recommend, when it comes to the part-time, to be able to include them and offer them coverage.
Okay, that's good to know. It's just good to address it because I remember getting those questions last year. We did see one question come through. It looks like Zach Page. What's the link for just the individual and the family plans? How would someone go ahead and get started on that?
When we get the information out, which will include the recorded webinar, we'll send the employer guide and contact info. We'll include that for the contact info.
Okay. And then I do have the link to Michael's calendar. Maybe I can, if that's easier for Zach, I can type that in and he can go ahead and meet with Michael. So I just sent that to Zach, but either way, if you want to use that calendar link for Michael, or if you want us just to send you, we'll send the information afterwards, you'll get it. So next question, it looks like Sherry had a question. So so that I understand correctly, each individual can choose their own plan. No two plans have to be the same, correct?
Now, we're looking at, I don't know if you're talking about each employer individual, if you're talking the employee. The way that implementation would be set up is the employer would select the plans that are offered to the employees. And then once the employer selects, then the employee can select which plan they want to go with. So if the employer selects more than one plan, medical, when we're going to talk medical plan, then the employee has the option to select which plan is best for them.
Gotcha. And Sherry, if you need more clarification, please type more of a clarifying question. We can tackle that for you. And so Bernard, another question we get is just the nuance of just having a husband and wife type of ownership. if a brand new franchisee is joining a brand of 5-star, what option was that you mentioned for a husband and wife specifically?
That would be under the comprehensive, because it is a
Okay.
group plan. Then they would, the husband and wife would be considered as one employee. They would have to add another W-2 full-time active employee.
To qualify, so they would
Correct.
be a husband, wife, and one employee, and then they would be able to qualify for the comprehensive plan.
Correct.
Got it. Okay. Yeah, we get those questions a lot, especially with the new franchise owners coming in. They're coming out of corporate life. They're not exactly sure what to do, and so it's a good thing to discuss. And so
Exactly.
I don't see any other questions on here. So if you have any last questions, please type them in and we'll tackle them. But you can see the contact information on your screen. If you have any questions, please, reach out to Michael, give him a call. And I'm not able to drop the chat of our landing page. So I was hoping, Michael, are you able to do that? Is to drop the link to our landing page? I sent you a direct message. Maybe you're able to provide that to the entire group. Just an easy way to get a hold of you.
We'll get the info out.
Okay.
Along with the recorded webinar and the employer guide. So
Yep.
we'll get that
Okay.
out to you, and we'll get it over to you. So if you want to send it out to distribute it to your franchisee or your brands, we'll get that over to
Okay.
you.
Well, that sounds great. And so I think that's it. I don't see any other questions coming in. So I think we're good to conclude, Bernard and Michael and Mandy. And any last words, Bernard or Michael, before we end things?
No, I'm glad with the partnership that we have with you, Stuart, and your franchisees, your different brands. I want to thank everybody for joining the webinar. I don't have anything else. Hope everyone has the great rest of your day.
Yeah, and I'll just echo that. Appreciate the partnership. It's a great thing to offer to your employees. We're really glad to have Franchise Benefit Solutions on board. And we'll get this recording out to everybody, and appreciate your taking the time. And I hope everybody has the good rest of their day.
Thank you.
Thanks. Take care.